My name's Carolyn Warner-Greer. I'm board certified in obstetrics and gynecology and addiction medicine, and today I'm going to talk about drug testing in the OBGYN's office. It's been long recommended that every pregnant woman be tested for certain illnesses. One of them is HIV. The reason that we test everyone for HIV is not because we feel that it's a very prevalent illness. It's because when someone has HIV, it's very amenable to treatment. And if it was a misdiagnosis, it could be very devastating to not only the mother for not getting treatment, but for the unborn child. The same goes for drug testing. The reason that we test people for drugs and everybody for drugs is because pregnancy sometimes is the one time where treatment for a substance use disorder can be started. It's a time where women are very motivated to get help. Sometimes it's the first time they've ever had a chance to get help. And when we don't treat people for substance use disorders in pregnancy, the outcome can be devastating not only for the mom, but the unborn child. But when treatment is started, it can have a great rewarding outcome for both. With any illness, there's certain things called screening and there's certain things called testing. And there's times where we ask about symptoms and there's times where we collect data that's very objective. For instance, thyroid disorders. If someone comes into my office and says that I feel like I have low thyroid, I would ask many, many questions, such as, do you have dry skin? Do you have problems with your bowels? Do you feel cold all the time? But I also would check their blood to see what their thyroid levels were. The same goes for substance use disorders. When patients come in, I talk a lot about their substance use patterns and all substances, but I also check a urine drug test to see what substances are present at that moment. A urine drug test doesn't tell me if someone has a substance use disorder. What they tell me about their use tells me that. But the drug test helps me with some objective data as well. You will have a relationship with your OBGYN, and the goal is to help you, not to get you in trouble. In 2016, Mike Pence, who was our governor before he left for the White House, passed a bill that said that OBGYNs should not use the results of drug tests to report pregnant women to the authorities, specifically DCS or law enforcement. And the reason for that is that we found when the results of these drug tests were used in a punitive fashion or to get people in trouble, that it kept pregnant women from coming to get help in the first place. And that is very true. But we know that when we use the data from a drug test along with actually talking to the patient, we can get information so we can make sure that we can help pregnant moms, one, do well in their pregnancy, have a good pregnancy outcome, but more importantly, that they can be the best moms for their family. If you have more questions about drug testing in your OBGYN's office, please reach out to your OBGYN.